Welcome back to Weekend Talk. I'm Lisa Reimer, and with me now is Dr. Val Zudans with the Florida Eye Institute, who has brought another guest with him, Hal Morris. Thanks for joining us.
Thank you, Lisa.
Dr. Zudans, we're going to talk about cataract surgery today. Tell us, what is a cataract?
Okay. I brought with me an eye model to show cataract because it really visually makes a lot more sense than just explaining it. With the eye, inside the eye, there is a lens that is supposed to be clear like this. And once the lens turns milky or cloudy and a patient's trying to look through that cloudy lens, it interferes with their vision. So that's what cataract is.
Is that very common?
It is incredibly common. Basically, if you live long enough, you will eventually develop cataract. And so cataract surgery turns out to be the most commonly performed surgery in the United States because everyone gets it, and you have two eyes, so it doubles the frequency.
So then is it easy to remove cataracts, and what is the rate of full recovery afterward?
It is actually a pretty straightforward procedure. I brought my patient to explain what it's like from the patient perspective. From the surgeon's perspective, it is a relatively straightforward procedure where I remove the milky lens and then replace it back with a new clear lens, and that gets the patient seeing better again. But Hal can tell you a little bit more about what that's like.
Hal, tell us about your vision impediment before the surgery.
Well, Lisa, I've had glasses. I've worn glasses since I was about 10 years old, and all through my life. And I have to tell you that at times they become uncomfortable, especially in sporting events, and I was very active, playing tennis, golf, skiing, but I always wore glasses. And as I got older, as Dr. Zudans says, I noticed that my vision was becoming less sharp, less bright, and developing cataracts. But always, as I have to say, as many patients do, you have some apprehension when you talk about your eyes. And when you think about having somebody work on your eyes, there's an apprehension. Maybe a fear or an unknown.
Because bad eyesight is better than no eyesight.
Absolutely, and the instances of success were known to me, and as I gained more courage, I came in to see Dr. Zudans. And I have to tell you, from the moment I walked into the Eye Institute a few weeks ago, I have never been treated so well, so fondly, so professionally. It was just a wonderful experience in a sense because you were calm, you were confident, and the procedure itself, if it took 15 minutes, I mean, it was, I was, basically out but not out. I knew they were working. There's absolutely no pain whatsoever, no discomfort whatsoever, which amazed me. And even when it was all over, when I was finished, I didn't even have a headache. And about after the surgery, I would say it took about 3 hours. You have tears in your eyes. You have the numbing medication that they put in and so forth. But then all of a sudden, I was at home, and I looked outside, and we have a pool in an atrium, and I looked outside, and all of a sudden, I could see all the petals on the flowers. And it just shot me. Now, even with my glasses, I couldn't see
Now,
that.
you told me you were wearing trifocals, mirror, far, and reading.
Yes, yes.
Now,
yes.
do you wear any glasses?
No, I don't wear any glasses whatsoever, except sunglasses out on the golf course or around. And I use, for reading, what you call inexpensive magnifying glasses. They're not prescription lenses, just to ease the strain of reading. It's an unbelievable procedure. But what I want to emphasize is what it brought home to me was the vividness and the brightness and the sharpness of all these years that I've been missing, especially on the golf course. Now, I love to play golf.
So has your golf game improved?
Matter of fact, it actually has, believe it or not.
I promise at least 10 strokes.
I have to tell you, I went out the other day on a very difficult course and shot an 82.
Wow, that's very impressive.
Yeah, it was the clarity. I can even follow the ball. When I was playing golf before, I would have to actually have somebody stand behind me and say, spot my ball. I couldn't see it. I couldn't see it in flight, and I couldn't see it when it landed. I could see maybe from 5 or 6 feet ahead, clearly when I addressed the ball. But once I hit the ball, I could never see it. Never see it in the fairway. And now I'm spotting other people's.
The whole flight, you see the ball, the whole.
Absolutely, it is an amazing, amazing process. And thanks to Dr. Zudans, I mean, I never would have experienced it. And I think he just did a marvelous job. And the staff there. I can't speak too highly of the staff. And that's even important on the follow-up visits.
Mm-hmm.
I mean, they're on time, they're punctual, they're professional.
Yeah, I like good
very
customer
important.
service.
You know,
We deserve
really,
good customer
That's right.
service.
it means a lot to a patient.
I think so
A
too.
tremendous amount of anxiety when you go into something like that. And to have a staff as professional and as well schooled in the initial examinations and the follow-up examinations, answering questions, and make accommodations.
Well, Dr. Zudans, excuse me for just 1 minute. I mean, you really impressed me with your credentials. Would you just tell our viewers about your credentials?
Well, I went to University of Florida, so I'm a Gator, and I got that going for me.
Yay.
Yeah. But I did my ophthalmology training at a place called Bascom Palmer Eye Institute, which is part of the University of Miami, and it's an excellent place to do your residency. I went to medical school at University of Florida as well as undergraduate there. And I've been in practice for 9 years now in Vero Beach at the Florida Eye Institute, and I do primarily cataract surgery and general ophthalmology. And I love my job. That's probably one of the best credentials because people who like what they're doing, I think, tend to take good care and enjoy it. And having patients like Hal, where you help someone go from not being able to, without glasses, his vision was 2400, which is the big E on the chart. Now he could see it better than that with glasses, correcting his astigmatism and things like that, but it still was not great even with his glasses before the cataract surgery. So, and to take that, and when he's now done and he says the things he said, and it was very kind of him to say the things that he said about my staff and our office, but it really is very rewarding. That's a reward to me of doing what I do. And
I like it so much. We're a family now. My wife came in and just did it the week after I did it.
Oh, now see,
2 weeks
that's
afterwards.
quite
So
a testimonial.
we're now a family visiting.
Right.
So yeah, it is a testimonial.
You were the guinea
Absolutely.
pig.
I was the first and she's the second, yeah.
Well, thank you very much. And if you are having problems with your eyes and perhaps are fearful that you may have cataracts, please call Dr. Val Zudans at the Florida Eye Institute. We have the phone number on the screen, and he'll be happy to help you with your vision problems. We'll be back with more after this.